All right. Well, I think it's probably a good moment to start. So again, let me say good morning, good afternoon, good evening to everybody. For those of you who don't know me, I'm Chris Byrer. I'm a professor at Johns Hopkins in infectious disease epidemiology, the Desmond Tutu Professor in Health and Human Rights. Our Center for Public Health and Human Rights is hosting this is our spring symposium event on the impacts of the attempted coup, the February 1 attempted coup in Burma, Myanmar, and its impacts on health, the well-being of the people of this country, and also specifically talking about attacks on healthcare workers and healthcare facilities, which is such an important, unfortunate, terrible outcome of this attempted coup. I'm just going to make a few brief introductory remarks, and then I'm going to introduce our three panelists. They're each going to make comments, and then we would like to have this as interactive as possible. So again, any questions or comments, please do put those in the Q&A. And please feel free. We'll also have our panelists speak to each other. We're all longtime colleagues and friends and collaborators. We've worked together for many years on these issues. And I have to say that for those of us who have a longer arc of working with Burma, Myanmar, or like Sandra Mon, who's going to be our first speaker, who's actually from the country originally, I don't think any of us really expected that we would be back in a place with a full-on military coup and a full-on military assault against the civilian people of this country in 2021. So it is truly a tragedy. There has already been enormous loss of life and suffering. And I just want to begin by saying that I think we have to acknowledge both the loss of life, civilians killed by the military, nonviolent protesters, civil disobedience protesters in many, many parts of the country. You'll see maps of that from Jen Lee all over the country. But also to acknowledge the extraordinary courage of the Burmese people, who are literally standing up unarmed with motorcycle helmets and handmade shields, trying to stand up against a very well-armed, largest standing army in Southeast Asia, who are intent on supporting really the desires for control on behalf of one man. And we should name him, and everybody should keep this name in mind, because it's too easy to say the Burmese military, they're known in Burmese as the Tatmadaw is doing this, the junta is doing that. General Min Aung Hlaing, Senior General Min Aung Hlaing, who was the architect of the ethnic cleansing against the Rohingya ethnic minority and religious minority in 2017, is the man behind this attempted coup. He is the man who is ordering some of the most aggressive shock troops that were used against the Rohingya and used against other ethnic nationalities in the country, the Karen and the Kachin, and putting those troops on the streets of this country and having them aim at the heads of civilian protesters. There have been an enormous number of headshot wounds. That is the direct orders of this man. He is under indictment for crimes against humanity at the International Criminal Court for leading the ethnic cleansing campaign against the Rohingya in 2017. And we should recognize that this really is the extraordinary anti-democratic and violent leadership of one military leader. I bring that up also because you don't really want to say delighted, but I'm very gratified and moved to say that the work you're going to hear about and the collaborations you're going to hear about today include our center and our longstanding partnership with Physicians for Human Rights. And we collaborated on the investigation of that ethnic cleansing and of morbidity and mortality among the Rohingya community forced to flee to camps in Bangladesh, 2018 and 2019. We published a number of scientific papers, but also public reports, white papers, and also put that data, our findings, into the International Criminal Court case against Senior General Min Aung Hlaing. But at the time, you wouldn't have seen Hopkins or the center or any of our names on that work, principally because we had ongoing projects in the country. We were trying to protect our partners and our staff, faculty who are from the country. But that has all changed. That dynamic has changed since February 1st because people now feel that this is really a life or death struggle to protect and defend and try and restore democracy and civil society to the country. And so people are much more willing to step forward. And in that regard, we really have to acknowledge what is called the Civil Defense Movement, the CDM. This is really unprecedented. There have been uprisings against military rule in this country, many of them. Many of you will remember the 1988 uprising that eventually led to the first elections, which Aung San Suu Kyi won in a landslide, but was never allowed to take power in. Then the Saffron Revolution, led by monks and nuns, also an extraordinary civil outpouring in the mid-2000s. But this is different. This is the entire civil service essentially refusing to participate in the perpetuation of military rule and refusing to participate in this coup. It's unprecedented. It is extremely impressive. And there have been some challenging aspects to this because so many healthcare workers and providers are part of the civil disobedience movement, have tried to provide alternatives to care, and also because the junta is actively blocking people's access to care, including people injured, wounded, shot by their troops in civil disobedience movements. So that is an extraordinarily important thing to pay attention to. Now, I also want to just make one comment because, of course, the world is in the grip of a pandemic, the COVID-19 pandemic, that prior to the February 1 attempted coup, Burma, Myanmar was actually doing quite well compared to its regional neighbors in terms of getting COVID vaccine immunization to healthcare workers. Essentially, the entire healthcare workforce who wanted a vaccine had gotten their first doses. They were using the AstraZeneca vaccine manufactured by the Serum Institute of India, SII. And they were really leading the way. That was violently interrupted by the coup. Many of those people have not gotten their second doses. The vaccines have been privatized. They've been now taken over and controlled by the military. We have very little sense of what is happening with what was and appeared to be a successful early rollout of COVID vaccines. So if nothing else is going on, that certainly is an aspect that has, of course, terrible implications for healthcare providers in the country, for the people of Burma, but also regionally, because as we know, failed immunization campaigns are transnational threats. And in that regard, we really would hope that ASEAN, the Association of Southeast Asian Nations, would be more active and doing more. So far, they have not done much. So those are really the things I wanted to say. I want to highlight the courage of the Burmese people, the extraordinary way they have come together to resist military rule, unarmed, really with the tools of social media, with civil disobedience, with their courage. It's a kind of Gandhian movement. And we really all sincerely hope that it succeeds and that this does not evolve into an armed civil war conflict in a failed state, which is certainly one of the alternatives that you will see in the media and that foreign policy types are debating about what could be the outcome here. We would really like to see military rule replaced with, obviously, a nonviolent civil disobedient victory. So with that, I'm going to turn to our first panelist. Sandra Sunin Mon is an infectious disease epidemiologist in our group in the center. She has done really extraordinary work since February 1, helping to organize the diaspora community, working with us and with PHR on data collection, on being able to really document what is happening, communicate with those on the front lines, and also doing advocacy on this side with our government and our representatives. And Sandra, we're so delighted. We know this is not easy. This is your country. These are your people, along with US, of course, a binational person now, but we really appreciate your willingness to participate. So over to you.
Thank you very much, Chris. And thank you everybody for attending today. Good afternoon, good evening to our audience. Like Chris said, my name is Sandra Sunemo. I am a Myanmar national, and I am senior staff here at the Center for Public Health and Human Rights. Just to start, I'm really grateful to my mentors and my colleagues here at Johns Hopkins for making this symposium even possible, and for providing such a great platform to raise awareness of what's going on in Myanmar. On February 1st, I, along with so many of my country folk back home and across the world, woke up just extremely angry and anxious about what was to unfold. We've, seen this before. I experienced the Saffron Revolution firsthand, and for many of us, this is our, third go around at such events under the Myanmar military. So to us, it's completely unacceptable at this point, and we all have, in our own ways, kicked into action. And to paraphrase what Chris said about CDM, I like to say that the gloves came off a long time ago, but it's time for us to throw the gauntlet down. So today, as a health professional and an epidemiologist, obviously my concern with the unfolding events was the escalating violence against healthcare workers and the status of the healthcare system, the health system in Myanmar. Also, particularly considering all of this is happening, as you know, in the middle of a still raging pandemic. Now, my colleague Jen will provide more information on this, but I want to quickly summarize just to set the stage and provide a little bit more context. To date, we, through Hopkins and CPHHR and Insecurity Insight, we've documented 109 incidents of attacks on health so far. And I want to make a note that this is not exhaustive. Much more data is missing just because the military is actively cutting communications in the country, and severe attacks, potentially more severe than in the rural areas, than in the urban areas, are in the rural areas, and these are being missed because they are poor, they do not have as great of an internet connection, and media coverage is lacking. So some of these attacks that we've documented include occupation of healthcare facilities, the deliberate obstruction of healthcare for both injured protesters as well as people with pre-existing health needs and urgent care needs, intimidation of healthcare workers. So far, since last week, we've had arrest warrants issued for doctors all throughout the country. And we are now looking at 120, although this is expected to rise in the next weeks or so. We also are facing the denial of healthcare for detained individuals. And these are detained individuals with pressing medical needs, either that are pre-existing or that were inflicted upon them through torture by the military during arrest. In terms of COVID, I was looking at some of the numbers reported by the Ministry of Health and Sports in Myanmar yesterday, and I crunched about an average of 33 cases and 1 death per day since February 1st. So that's not too bad, right? But compare this to January 31st, right before the coup, the attempted coup, that showed a daily average of 367 cases and 10 deaths per day. So, the numbers kind of are pretty clear here. We are seeing the local surveillance capacity in Myanmar for COVID stripped to its bare bones at this point. On top of that, as Chris said, vaccination efforts have been severely dampened, not only by widespread civilian distrust of who is administering the vaccines, but also through a systematic desecration of Myanmar's health workforce. Now, in a time where we're seeing third and fourth waves and emerging variants to COVID-19, a lack of surveillance and disease control in Myanmar could develop not just into a regional issue, but a global security issue. And we have to all keep this in mind. So as we enter this discussion, I do want to keep 3 sort of points highlighted just for our attendees to acknowledge. The first is that I personally will be using the term Myanmar to refer to my country of origin. And this is merely a personal stance against our colonial history and really just kind of making the point that we don't want to be subjected to imperialistic powers anymore. However, my colleagues and others may use the term Burma to keep with diplomatic discourse. And in my opinion, both are appropriate, since we do have to acknowledge that there has never been a consensus about the name of our country. Because at the end of the day, the powers that governed us, from the Burma kingdoms to British rule to modern capitalistic relations, has never been fair to the people that reside in our lands. Second, I will speak today in my personal identity as a Burma and Hmong Buddhist. But beyond that, of course, I will be speaking in my professional capacity as an infectious disease epidemiologist. Both of these identities do carry several defining privileges and shortcomings that I would like our audience to acknowledge and keep in mind as I offer my insights. I will try my best to speak for my fellow Myanmar people, but please feel free to add or correct me if I overgeneralize your experience. Finally, the name Rohingya, in all of its pronunciations across the world, Rohingya, 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 must be recognized. The plight of our Rohingya siblings must be acknowledged for Myanmar to move forward as a country. And as folks at the center here in PHR know very well through our research on the 2017 crisis, we feel that this has to be something that's, at the forefront of the thinking around Myanmar's future as an equal federal democracy. So with that, I will turn the floor back over to Chris, who will now introduce our next speaker. Thank you, Chris.
Thanks so much, Sandra. And I think you're absolutely right about the extraordinary number and rate of these attacks on healthcare providers. Jen Lee is our next speaker, and she's going to show you some data from these attacks. Jen is is working as one of the kind of lead people on the Burma campaign effort, or Burma Myanmar campaign at Physicians for Human Rights. Happy to say that she just completed a postdoctoral fellowship with us at the center and also at the Center for Humanitarian Health. Prior to that, she had just finished a PhD at Harvard. And prior to that, we worked together for many years on the Thai-Burma border. So she is a person who really knows the country very well, has deep and long-standing public health experience, and also played really vital roles in the Rohingya assessment that Sandra and I both mentioned before. So Dr. Lee, please.
Thanks, Chris, and thanks so much, everyone, for taking a few minutes to talk about this issue today, which I think is of critical importance. Yeah, so as Chris mentioned, I've been working on Myanmar for almost a decade, and off and on with Chris in the center and with other colleagues and friends, and currently with Physicians for Human Rights. I worked on the Thai-Myanmar border for a number of years and partnered with health organizations trying to provide healthcare in those contexts where health was under attack by the military regime at that time, as well as on the China and India borders. And then in 2017, partnering with PHR as well to do the Rohingya documentation. And I think, it's important to note that this work over all of these years and preceding my own work has been focusing on increasing access to health for the people of Myanmar and documenting human rights violations. And we find ourselves at just another point in this unfolding story of Myanmar where these are, again, really crucial issues. And I'm sorry that this work has to continue, but I'm glad that there are people who are in the country committed and brave enough to stand up and raise their voice and help to document what's happening. So Physicians for Human Rights, has been doing documentation work in Myanmar for quite a while, including in Eastern Burma. But currently, in terms of what's happened since February 1st, we're focusing on a few different areas. One of the critical areas is really focusing on documenting forensic evidence of the crimes of excessive use of force against protesters and torture of detainees. So we're partnering with colleagues on the ground in Yangon and Mandalay and other places to take medical documentation, photographic evidence of some of these crimes so that we can partner with forensic experts to provide, forensic evaluation of the impacts both directly, you know, to individual people's health that's happening in the country, to document it so that it's recorded for posterity, but also critically so that it can be used as evidence in justice and accountability mechanisms. Chris mentioned previously that our work with the Rohingya has, you know, been shared with the International Criminal Court, Office of the Prosecutor, the International Investigative Mechanism for Myanmar, and other accountability mechanisms. And our intent is to do the same here, to be able to provide some high quality documentation that can serve in evidentiary purposes in these kinds of justice and accountability mechanisms. So to that end, we've been collecting documentation, collecting videos and photos, radiography, you know, x-rays of bullets, you know, medical records and things like this of these injuries and these crimes. And we're also helping to train medics and physicians who are providing care to frontline health workers and to detainees to help them increase their own ability to provide high quality documentation. And in cooperation and in conjunction with all of this work, we're also looking to document the full scope of crimes against health that have been occurring since the coup. And these have been notable in their scope and scale, far beyond what you might expect with a political uprising. In part, that's because medical professionals have been at the front of the civil disobedience movement since it rose. But also, I think the military has really stepped beyond its bounds to indiscriminately target healthcare workers and health facilities in ways that very much violate medical neutrality and their responsibilities to ensure access to healthcare for the citizens of Myanmar. So I'd like to share now just a little bit of the data that's been collected by a partnership between Insecurity Insight, Physicians for Human Rights, and the Center for Public Health and Human Rights that'll be published this week in a short report highlighting some of these attacks. So this report that we're releasing this week only covers, you know, a 2-month period, and it's already a shockingly large number of attacks. I've included a link here to the embargoed report that'll be newly released as of this showing. And this is the summary of the information that we've collected thus far. Sandra referred to the number of 109 attacks against health, and this includes quite a number of health workers that have been arrested. As Sandra mentioned, this number has increased notably over the last week or so, and we're up to now over 120 arrest warrants that have been issued, but health workers are also being arrested without warning and without warrant. This is at their places of work and at their home during the day and during the night. And it's caused quite a number of health providers to have to flee and go into hiding, which not only is a personal threat to them, but is interfering with their ability to provide really critically needed health services. There have been raids and occupation of hospitals, both public and private. Almost all of the public hospitals in the country now have a garrison of Tatmadaw troops, which is serving to intimidate people from coming there to provide medical care, particularly those affiliated with the civil disobedience movement. There have been direct attacks against hospitals where, you know, bullets have been fired through the windows, gas canisters have been shot, staff have been injured by rubber bullets, very, very direct attacks against healthcare facilities. Materials and supplies have been confiscated. A number of healthcare workers have been injured, both those providing care on the front lines who are very frequently targeted for providing care and have been shot at and picked off by snipers just for trying to provide medical care, and also in other contexts as well. And a number of healthcare workers in this context have been killed as well. I'd also just like to note that you know, this is also extending to ambulances that are being shot at, that are being damaged, that have been confiscated. So you are at risk trying to provide medical care. You are at risk trying to seek medical care. You are at risk during the process of being transported to find medical care. This is a very grave situation. This is just a little timeline of the attacks. You can see there's a couple of big spikes, particularly over March 7th and 8th, when those forces were deployed to occupy a great number of hospitals. And I also just wanted to highlight this map. The Insecurity Insight routinely documents attacks against health. And this, upswing in attacks specifically in Myanmar has been captured on this map. And you can zoom in to Myanmar and see that, there have been a number of attacks this year so far. They're mapped, geolocated on the map. And if we zoom in, you can see specific examples with some notations about what happened, such as, occupation of hospitals. And this is in Mandalay a case of an ambulance being shot at. So this is an excellent resource that's put together to keep track of these incidents. We will continue to work with Insecurity Insight and Johns Hopkins to track these events going forward. Unfortunately, we don't see them ending soon. So we'll continue our documentation work with the goal of, again, being able to share this documentation and evidence with justice and accountability mechanisms that we are communicating with. So I'll pause there and happy to take questions later.
Thank you, Jen. Really appreciate that. And as you can see, these are really widespread attacks. They're happening all over the country and really at every step in people's access to care. Our last panelist this morning is my friend and colleague, Len Rubenstein. Len is a professor of the practice of public health at Johns Hopkins at the Bloomberg School. He's been on the faculty now for a little over a decade. Previous to that, he was a former president of Physicians for Human Rights. So he is very much a part of our family and connectivity around these issues. He has been leading a coalition on attacks against healthcare workers for several years now, and actually has a new book that will be out in September, Perilous Medicine: The Struggle to Protect Healthcare Workers from the Violence of War. And I'm happy to say, I think there may be some advisory committee members of the Center for Public Health and Human Rights on the call. I hope so. Welcome to you all, and thank you on behalf of the center and on behalf of Len for your support for that book. It really was very meaningful, and now, of course, it is terribly timely. So Len, over to you.
Thank you, Chris. And I want to thank my colleagues, Sandra and Jen and many others at PHR and elsewhere who are, and especially on the ground, who are documenting these attacks. The violence is very disturbing, but also it takes a lot of courage to report them. And I think we have to acknowledge the people on the ground who, at great risk to themselves, keep the information flowing. I'd like to make 3 points to put what's going on there now in a bit of a broader perspective, both within the country and more globally. First, there is such a long history of Tatmadaw brutality, not just as a practice, but as a policy. It's one of the most unaccountable military organizations in the world, a kind of independent power center in the country. It even controls large sectors of the economy. And we, of course, know about the genocide against the Rohingya. And its abuses started decades and decades ago, back a half century, when the war against people in Eastern ethnic provinces sought autonomy. And that response was a campaign of suppression, and the population itself was the target, just as it is now. At one point, it adopted a policy called Four Cuts, which was a campaign of abuse and displacement against the ethnic group in those eastern states. And attacks on healthcare were very central to its strategy. About a decade ago, in response to requests from organizations in the region, colleagues and I engaged in a study of violence against health workers in Eastern Myanmar. These were indigenous workers, a threat to no one, who traveled from village to village to provide healthcare One group many of you may have heard of is called the Backpack Health Workers Group, and was enabled medics to serve a suffering population. But the Tatmadaw soldiers targeted them. Encountering them when they traveled or in a village could mean confiscation of their supplies, but also kidnapping and sometimes killing. And it also included burning clinics, because the strategy at its base was an attack on the entire population, whether you needed healthcare or whether you would provide healthcare to those in need. One of the health workers we spoke to said to us, because we are health workers for our people, they know this and will kill us. This leads to my second point. Engaging for medical support to people engaged in political activity, or when health workers themselves engage in political activity, is protected under the law. There's a myth among too many right-thinking people, that political engagement by health workers removes their protections provided by human rights and international humanitarian law, because then they are not considered neutral. They're taking sides. The claim is often raised by people who otherwise call for protection of healthcare. But they also think that the immunity these individuals have disappears when they engage in political activities. That is profoundly wrong. Lack of political engagement and lack of neutrality is not a prerequisite for immunity from arrest, from punishment, or any other kind of sanction. And the same, of course, goes to institutions like hospitals. They enjoy protections for free expression and also for offering healthcare services to others. A UN Special Rapporteur, Agnes Callamard, who was very recently and very appropriately appointed to become Secretary General of Amnesty International, put it well: saving lives is not a crime. Which leads me to a third point about what we need to do. I saw a question in the Q&A about what the international community, especially the international medical, public health, and health community generally should do. The importance of mobilization and solidarity toward international action is essential. There is no way that people can be protected without outside support. We respect, we honor their courage, but we need to support them. We're a few weeks away from the 5th anniversary of a landmark UN Security Council resolution committing to protect healthcare from violence. It's unfortunate that governments have not acted to implement the resolution, not only to respect the law themselves, but ensure that perpetrators face consequences of violations and that the other governments act to make sure that the violence stops. We've seen in Syria and Yemen and other places that the international community has ignored that obligation. We can't let that continue here. There's a lot that can be done. The first thing is solidarity, that medical organizations all over the world, whether nurses, doctors, public health groups, need to speak up. Issuing a statement, for example, may not seem like a major intervention, but for people on the ground, it is extremely important because it shows that they have international support, and it shows their oppressors that they have international support. There are other things the international community can do. There have to be means for getting aid in a humanitarian corridor. There have to be even greater sanctions against the perpetrators than there are now. There is even some consideration of a no-fly zone if the neighboring countries agreed to it to protect displaced people. We have to keep pushing for all of these kinds of interventions until the military leadership stops its assault on democracy and its assault on those who are both urging democracy, and those who were serving through medical care those very people. So I'll stop there, and I'm happy to continue this discussion.
Well, thank you, Len. And I see that there are a number of really excellent questions in the Q&A. One of them, I'll turn first to Jan Lee, if I can. Jan, there's a question about the forensic documentation. And I know PHR has been involved also in training during this time. Perhaps you can speak to what efforts are underway to try and really assist with that component.
Sure. Yes, absolutely. Yeah, so I think what's happening right now is there's a lot of documentation occurring that are, informal photographs that are snapped from a distance and shared via public social media. We're trying to work with a few different groups of partners to ensure that documentation is meeting evidentiary standards so that it can very specifically be used in accountability mechanisms. And this includes training partners in kind of what elements of documentation are important in order to meet those standards. So, documenting the context and the specific medical sequelae of incidences, and making sure that photographs are showing clearly the wounds and the injuries that are happening, and include reference measures and things of this sort. So we've trained 2 groups of partners on both forensic documentation and forensic photography, and we're gearing up to do a training with a 3rd set of partners as well, to put it out there. If you are in Myanmar and doing, providing medical care or seeing these kinds of injuries, please be in touch and we can talk to you about providing that kind of support as well. And this is something that, we've talked to the International Investigative Mechanism in Myanmar, and they think that this kind of training is valuable to increase the utility of the documentation that's occurring. And we hope that it's, increasing the capacity of our partners to do human rights documentation in real time on the ground.
Very helpful, very helpful. There are a couple of questions relating, Len, a little bit to the question that you answered. Maybe you and Sandra both would be interested in taking this one on. So this is from an anonymous attendee. To what extent should neutral and impartial humanitarian medical INGOs, that's international NGOs, interact with the military junta in order to continue their operations? Should they consider assisting with COVID vaccinations, given that this is a life-threatening public health intervention? It is an ethical dilemma.
I can start, and we'd love to hear what Sandra said. Myanmar has had a very fraught relationship with national humanitarian organizations. It basically prohibited them from participating in assistance in the eastern provinces. At some point during most of the decades of that war, it has severely restricted Doctors Without Borders, MSF, to serve the Rohingya, and it would be, it can be expected that they will resist any efforts by humanitarian organizations to help in this situation. Nevertheless, those organizations, although I haven't spoken to them, have the ability to provide assistance, and they should be permitted in. Unfortunately, it's up to the government to allow these groups to come in. And I think they could help with COVID, they can help in many ways. And they are very skilled at managing relationships with difficult governments. But until they're allowed in and allowed to do their work independently and with integrity, it won't be possible. Sandra may have other thoughts.
No, I agree for the most part. I think kind of the main thing that's standing out to me right now is obviously the Red Cross's attendance at the Armed Forces Day celebrations, while the civilians are being massacred outside in the streets. So that has created a conflict in country where medical personnel no longer trust the Red Cross, and they wonder, okay, are they colluding with the junta, et cetera, et cetera. And these are things that are definitely worth keeping in mind if you are an NGO, INGO engaging with the junta. What kind of dynamics that could generate, among other medical personnel on the ground. That said, I think the angle of humanitarian aid and the pressing need for that is definitely something worth engaging with the junta on. And that's why, it's a little bit of an unpopular opinion, but the engagement with Mae Online through ASEAN at this next summit to start dialogue, especially around humanitarian aid, is fairly crucial. If there is a possibility of an inroads with the country that way, then by all means, I think this is something that some governments need to consider taking. This was something we saw in Nargis as well, right? Humanitarian aid was completely blocked off, and the only way you could really get anything in was by engaging directly with the government at the time. So it's definitely a fraught subject, but there are benefits and pros and cons that need to be weighed if you are an INGO interacting with the junta.
There's a question that maybe I'll take, which is why are COVID-19 cases not increasing during these events? And I think Sandra already alluded to this, that of course, if you're not measuring, counting, and testing, you're not going to find cases. So I think all the evidence would suggest that there is ongoing or even increasing COVID transmission. And we certainly know there is a decreased access to healthcare for so many people. So it is very unlikely that there also are not increases in complications and sadly in deaths. The issue, of course, is that there's been this massive disruption of the healthcare system and the public healthcare system. And so it's what we call a reporting issue, a reporting bias. It looks superficially like the numbers are going down. That's just because the reporting is dramatically going down. So we probably won't know for a while. And certainly if this situation that we're in right now continues, we won't know for a good while what's actually happening on the ground. This is a tough question, but I do think it's an important one, and maybe both Sandra and Jen have thoughts on this. Many of the people killed, their bodies are being buried as soon as possible by families. Some of this is for religious reasons, but some of it is families are afraid that people may take their bodies of their loved ones away. So what can we do to address this situation and educate people? I think this goes back in some ways to the forensic questions.
I just have something really quick to say about that, and then Jen, maybe I'll hand it over to you.
Sure.
I think with this, this is more something that the medical personnel need to take on. This is why the forensics evaluation and forensics photography is so crucial, to allow families the dignity of being able to bury their loved ones with respect. We obviously do not want to exhume any bodies that have already been buried or desecrate anything that has been set up out of respect for those who have passed. That said, the immediacy or the urgency there is that medical personnel tending to these cases need to be trained and aware of the appropriate forensic needs, right, to document the extent of these injuries and deaths while they are with the patient. Jen?
Yeah, I mean, we've definitely heard cases of the military taking away, confiscating the bodies of people that have been killed, which is terrible. I'd like to say a couple of things. And one is that, when forensic documentation is feasible and possible, that provides important evidence. But as Sandra said, I think the dignity of an individual and their family is also important. And you can still document a case without, you can still document the circumstances of a case in a way that can be meaningful even without the body itself. But if there is the means to do some kind of image documentation beforehand during preparation. I think that can be very helpful. But still, just documenting the circumstances of the case, the location and what has happened can also be useful. So I think all of that is adding to the overall picture of what's happening. There's patterns that we're looking to document as well, in terms of the mechanisms that the military is using to respond and the ways that people are being killed. And, you don't necessarily need every single picture to be able to really add to the documentation of those patterns. So use discretion, and imagery is helpful when it's possible, but in the cases where it's not, there's still useful documentation that can occur.
Great. Len, this is maybe a question that you'd be well poised to answer. Is it possible for the international community to do an intervention like the establishment of safe zones for healthcare provision? And I'm thinking here about, for example, some of the cross-border work like the backpack medics that we have talked about, that you've talked about in your opening comments.
Yeah, there was actually a question that said, boy, this looks a lot like Syria 10 years ago. And it really does, in that you have a completely unaccountable government that is incredibly brutal, that treats peaceful protest as either terrorism or illegitimate. And there is no source of restraint, no institutions within the country that can stop it. So the question is what the international community can do. The question of safe zones has a couple of dimensions. One is normally you would require a UN Security Council resolution to have a formal authorization. And given the politics of the Security Council, where China and Russia have vetoes, we can't really expect that to happen. We know there are complicated relationships China has with the junta, but the UN Security Council process is so broken that it would make it difficult, even though it's possible that it could. It has the power to do it. In the absence of that, you need leadership among governments to say, we are going to establish it outside that process, and it doesn't have any kind of international authorization, but it can be done. But then they have to be willing to enforce it. And that's where you get into complications, because enforcing it means willing to use force, lethal force, to make sure that it's complied with. And that's where the politics and the diplomacy get very difficult. But there have been calls within the opposition in Myanmar for these kinds of zones. And I think we ought to respect that. And there ought to be pressure on countries in the region to establish it. So it's a complicated question, it's a complicated answer, but I believe it is worth pressing for one.
And I could just add a note. I mean, I think it's also, in addition, important to note that while the military is undermining the national health system and the ability to access care, for quite a while, there have been community-based organizations and ethnic health organizations that have been successfully providing care, access to healthcare in the ethnic minority regions and in the border regions. And those organizations still exist and are still capable of providing health services. So something else that we can do is to continue to support their work. And if that means revisiting cross-border mechanisms to provide that support, potentially that's another way that we can support ongoing access to health in the country.
And I would just say, I would just add that in those particular border areas where there is cross-border movement of people, there is some expectation that people are going to be fleeing the country because of the violence. In some cases because they've been involved and are now being targeted, in others because life is just becoming untenable for whatever reason. And of course, now in the era of COVID, movements of people cause concern and are associated with potential for COVID spread. So I think it's going to be very important to think about access to immunizations for those populations so that they can move safely and that they will not be stigmatized and labeled in some way or another as a vector of COVID transmission. That is maybe a new aspect of thinking about humanitarian assistance and humanitarian relief in the era that we're in. As I said in my opening comments, this was a country that was doing quite well with immunizing healthcare workers. And it's going to be very important also to have access for all of those ethnic organization medics, health care providers and staff to protect them as well. We all agree, I think, that healthcare workers everywhere deserve access to these vaccines. There's another question relating to the medics, and Jen, this is maybe a good one for you. The backpack workers and others are already dealing with civil defense movement people who have fled to their areas, and so I wonder if you can speak to maybe it's the feasibility or viability of cross-border assistance in those areas.
Yeah, I definitely think that's an important thing to explore. I mean, I think PHR and Johns Hopkins have long ties with these organizations as well, and we're in touch with them in the border areas. And I think finding ways to support them both for their ongoing work and for their new support to CDM members, both protecting them and ensuring access to care are important. And as you mentioned, as there's increased flows across the border, looking at the impacts on COVID and the increased needs for access to healthcare, I think they're well positioned to help in that work as well. And we should explore how to bring them in and support them in that work.
Mm-hmm. Mm-hmm. I'll ask you all to maybe just make one brief kind of closing statement, but let me just say there's one last question, which is asking us to go beyond COVID and thinking about other healthcare services, HIV/AIDS, family planning, childhood immunizations. What are the public health concerns there? I can certainly say I think we're going into a data-free zone on all of these healthcare issues because there's been such severe disruption of the healthcare system by the military and by Min Aung Hlaing and his forces. But I don't know, Sandra, you're very up on these data if you've seen reports of impacts on other sectors.
Sure, yes, there's been multiple reports about essential HIV services being interrupted. Same has happened for TB clinics. MSF has actually reported on this. So there's always the concern of, drug-resistant TB, drug-resistant malaria. And then one thing that I do want to highlight is that, the curfews that have been enforced, and now the military has reenacted the township household registration law, which is preventing people from seeking medical treatment at safe houses or staying at clinics, like makeshift clinics overnight. Those have also severely impacted care for chronic illnesses, referral streams, even complications in pregnancy, kind of emergency labor needs that have arisen. The curfew obviously prevents people from going out, otherwise they'll be shot in places where martial law has been instated. So all of those kind of compounded have really destabilized the health system in the country and has really made, the lives of both medics and civilians extremely challenging when navigating health needs.
Yeah, I think we're really just beginning to see the overall health impacts. The repercussions are going to be broad. And I think this curfew issue in particular is really key. We're not just talking about protesters, we're talking about the general population who can't access, healthcare for everything from childbirth to respiratory distress to, the normal health concerns of a population. Ambulances are being attacked, health workers are prevented from providing care. It's a serious disruption that's going to have wide-ranging health ramifications.
Well, I'm mindful of the time and I realize that we've come to the end of the hour. It's been an extraordinary conversation. I want to thank Len, Jen, and Sandra for your contributions and inputs. Also, all of you in the audience, many questions. I'm sorry we didn't get to them all. I said this earlier, but I'll say it again now that we're at the end of the hour, that we have recorded this. We will be posting it on our center website. We'll also be putting it out on social media. Please do share it with others. For those who couldn't attend, please do view it when you can. And let me just say, I know that this is a grave situation, and these are tough issues to deal with, and it's painful to talk about what is happening to the people of this country. But I hope that you've come away also with the sense that there are things that we can do, that international advocacy matters, that people do want the rest, they want to know that the rest of the world is paying attention to their suffering, is hearing it and seeing it and understanding what is happening. And that is extremely important. And the documentation work is very important for the eventual work of justice. And this is a country that has been sorely in need of a true reckoning of its history and its past, of the actions of this military, and where so many people have been denied justice and accountability. Hopefully that's going to end, and there will be accountability for these crimes, and we will play as much of a role as we are able to in doing that. We're very committed to that, and we think that that's very fundamental to going forward. So again, I want to thank everybody for your attendance. Pay attention to what is happening in this country. It may seem far away, but in fact, the undermining of emerging democracy and civil society and a return to military rule is happening in many places, and it is a trend we really do not want to see continue in our world. So once again, I want to thank everybody, and particularly our three speakers. And please do look at the website, follow the work that we're doing. We're also going to be publishing in the gray literature, but also in the scientific literature. And with that, I'm going to ask Sandra to say thank you in Burmese. I will thank all of you. I think it's Jesu Timbade, but I don't really say it very well with the tones. Sandra?
I will not only say thank you, I will say our revolution will prevail. So, alone, Jesu miai demare, iero poayami.
Okay, we're doing it. Take care.
Thank you, everybody.
Thank you so much. Bye-bye.